Most people avoid facial aesthetic surgery because they have a fear of scars, especially with facelifts, where you have visible scars on your face and in front of your ears. Is it even possible to get a refreshed, younger look without having these scars noticeable for the rest of your life? Well, it is possible. And I'm going to explain to you today a technique that I've developed over years called the Inside Out approach to facelifting, where you have no visible scars, no telltale signs, and you can't tell you've had any surgery except you look younger, refreshed, and natural. This Inside Out facelift is a completely different approach from traditional facelifts, so let me show you how. When a person considers a facelift, it's usually because they've seen some pictures or someone's mistaken them for their mom, or they have mistaken themselves for their mom. They look in the mirror and they think, oh my goodness, because people will have an age kind of a surge where you'll feel like you age 4 or 5 years in 1 year. And that's when things really start to get lax. So the challenge is gravity does not go to sleep at night when we do. And also accumulated sun damage affects the quality of your skin. So you start to lose volume, your skin starts to have that sallowness and that lack of glow. And then gravity shifts things so that your cheeks will go down, you have fullness of your fold, you'll have a jowl, you'll have some little cords in your neck. All those are signs of needing a facelift. The one thing that kind of scares everybody, really two things, is scars on their face and undergoing general anesthesia. Everybody knows somebody that's had trouble with anesthesia, somebody that maybe had anesthesia and it went well, but they heard things or they felt things while they were under anesthesia. And we all have a friend or neighbor that you can see the visible scars, they put their hair up, they forget they have them behind their ears and in their hair, and they go to a nice outing and people see it. And the other thing that happens is the skin on your cheek is not like the skin around your ear. And so when people stretch that skin around the ear, the entire tragus in the middle of the ear and the earlobe looks distorted. Or it's the kind of person where they have changes to their face, but their hands look older. Well, it's the same thing with your earlobe. If you can't match that tissue, it doesn't look natural. I have devised a way, because of my training in ophthalmology and plastic surgery and my 4 board certifications, I have people come to me from all over the world to do what's called an inside out facelift. And I access the areas hidden in the hair, right above the ear, right behind the earlobe, so there's no incision on your face. I also sneak into some areas inside your mouth, behind your eyelid, and some various areas where you don't have the telltale signs that you have with a facelift. The unfortunate thing is my practice is composed of 60% what I like to affectionately call rescue surgery. Most people call botch surgery, where I'm repairing things from other doctors. I can always make a bad scar a good scar, meaning that I can make it look a lot better and less perceptible. But a scar is a scar and it's going to be visible. So it's always nice to have this done originally so you never have to have a scar from a facelift that's visible. If I'm doing a corrective surgery, I still use these techniques to minimize the downtime, to minimize the scarring. So number one, a facelift that looks natural reconditions your skin without scarring. The second big factor to think about is anesthesia. I can either do this with a local anesthesia or I can do it with sedation only. The advantage of that is you never have general anesthesia. You don't have a tube in your throat. You don't feel like you've had the flu for days. You don't have your blood pressure fluctuating a lot like you do when you undergo induction with general anesthesia. And I only do it with physician anesthesiologists because even though you don't go under general, I feel like it's the safest way to approach. And I'm all about safety as well as aesthetic improvement. And the other thing that's important is your skin is not going to improve if you stretch it like a traditional facelift. So what I do is advanced laser resurfacing with an ultra clear laser that heals much faster than a CO2 laser, and it improves the quality of the skin. It would be very similar to if we got a new mattress for you on your bed and we put the same cotton sheet on. It's not going to do it justice. So imagine if we could stretch out that cotton sheet and we had the ability to just flip that sheet over, and now it's a satin sheet. So it's a quality improvement. That's what the laser does. That's why we call it resurfacing. It's like giving your skin a brand new surface. So all those years of sun damage, pigment changes, hormone changes, all get erased with laser resurfacing. And the other factor that is very important is you have ligaments that are deep down to the bone, and that's on the very inside of your facial anatomy. And that's the reason it's called an inside out approach. A deep plane facelift is done by about 5% of the surgeons across the world. But the deep plane is not really the deepest plane. It's deeper than a superficial layer we call the SMAS, but it's only deeper than that. So it's in the upper third of the face. The deepest layer is down to the bony architecture. And as you get older, those ligaments loosen and move and the bone changes. So that's the reason I approach everything from the inside out. Another good way to think about it is if you had your car and you're going to work on the engine, would you take off your hood and damage your whole car so you could work on the engine? Or would you gently lift the hood, work on the engine, and then place it back so you couldn't tell anything was done? That's what an inside-out approach is. Most surgeons that learn surgery learn in their fellowship from somebody that learned 20 years ago. And then you talk to that person, they learned it 20 years ago. So people, they keep taking the hood off the car to fix the engine, but you really don't need to do that. With advanced technology, endoscopes and lasers, you're able to do all of this surgery like old school traditional facelifts. So in my opinion, there's really no reason to have all those scars around your ears. And even though sometimes people show their before and after pictures and they have a slight pink line and they say that pinkness will go away, they're right, it does go away. It turns completely white. So people have loss of pigmentation, and so they have a visible scar. And if you're a person of color, that skin is going to look much lighter and much more noticeable. And you also have the possibility of having a keloid scar, which is a raised scar. So the bottom line is, let's avoid a scar. I consider when I'm teaching my fellows, I tell them the worst 4-letter word you could say in plastic surgery is a scar. So do your homework, do your research. There's plenty of ways to have aesthetic treatments to your face. My recommendation would be an inside-out approach. So if that sounds good, come see us at Oculus Plastic Surgery in Atlanta. Thank you.